All right, folks. Well, thank you for hanging with us this afternoon or evening, depending on which part of the country you're in. My name is David Painter, and I'm a community liaison in Ohio. You already met Kendra. She is one of my colleagues with the Ohio Senior Health Insurance Information Program, or shortened to OSHIP with a P. I'm going to bring out the first part of this presentation to an end. I'm going to talk about Medicare and employer coverage. First thing we'll talk about is the coordination of benefits. As we know, the government loves using initials for everything, so we're going to call it the COB. Rules about how Medicare and other insurance share their responsibility for claims. Pretty straightforward stuff. Primary insurance pays first, secondary insurance is second. There is an organization, an agency called the Benefits Coordination Recovery Center, and they just make sure that's all paid in the correct order. What we're going to talk about first is the coordination of benefits for active employee insurance. So in other words, I'm Medicare eligible or perhaps already on Medicare, and I'm already covered by my employer or my spouse's employer coverage. Medicare is usually the primary coverage there, with these exceptions. If I am over 65 and on a group plan that has more than 20 members, then it's going to pay secondary. If I'm under 65, and on a group plan that has more than 100 members. And then end-stage renal disease, we learned about that earlier. That's one of the conditions where you can sign up for Medicare prior to age 65. Folks with ESRD, end-stage renal disease, Medicare pays primary after 30 months. Medicare does not pay if the health care is under liability or no-fault coverage. We're going to get into that in a few slides here. Or if another federal insurance is involved. And the examples we have down here, workers' compensation, the Veterans Administration, something along those lines. So, active employee insurance if I'm 65 or older. So as we learned on the last slide, Medicare is usually going to pay primary if the group health plan has less than 20 employees. They sometimes call that a small group health plan. Less than 20 employees are on the health plan. Medicare is going to be my primary insurance, even if I'm still employed. Medicare is going to pay secondary if the group health plan has more than 20 employees, so a larger one. And there are a number of protections available for folks who have group health plans with more than 20 employees. The coverage has to be the same coverage as offered to others. The plans cannot pay less or discriminate against individuals on Medicare. And employers whose plans should pay primary cannot encourage individuals to drop employee coverage and enroll in Medicare. And these protections, they do not apply to those small plans with less than 20 employees. And but these are things to be aware of. Some of you might be turning 65. Maybe you're thinking about signing up for Medicare, but you're not ready to retire yet. Or maybe you have a spouse that's still working and you're covered under that spouse's employer plan. Here, these are some things to sort of take note of to make sure they're not trying to push into something that they cannot legally do. All right, now active employee insurance, and you're under 65. So an individual eligible for Medicare due to disability and covered by insurance from their spouse or another eligible family member, current employer. Medicare is still going to pay primary if the employee has less than if the employer has less than 100 employees, so it's much bigger at this point. And Medicare is going to pay secondary if it has more than 100 employees. So it's a little bit different. You know, it's one of those things, you know, whether it's because I'm 65 or I qualify for some reason under 65, different numbers. And then last but not least, once again, talking about the end-stage renal disease, that kidney failure. Individuals eligible for Medicare due to end-stage renal disease are covered under an employer health plan. There's a 30-month coordination period. It begins the first month that they are eligible for Medicare. Doesn't mean that they necessarily enrolled in Medicare, but at the first month that they were eligible for Medicare is when that 30-month period begins. Medicare is going to pay secondary during those first 30 months, so 2.5 years is another way to think about it. And Medicare is going to be primary after those 30 months, even if you're still employed. COBRA. Now, COBRA has a very long name that I don't want you to spend 1 second trying to jot down or memorize. The Consolidated Omnibus Budget Reconciliation Act, because that to me does not say I can continue my health insurance. Just remember the term COBRA. It's a federal law that gives individuals the right to purchase continued health coverage under the employer plan after termination of employment. So basically how COBRA works is you've left your job, maybe you're retired, and they're offering that you can continue to keep that same health insurance, but you're going to be paying the full price. You're paying the full premium. The employer's not subsidizing that as they do when you're employed there. It is something that's come up a lot in the last year, 18 months, because a lot of folks have left their employer or retired earlier than what they thought they originally were planning on retiring. And COBRA has become a big issue this year. With COBRA, Medicare, if I have COBRA and Medicare, Medicare will always be primary. COBRA will always be secondary. Now, because of that, COBRA is not considered an equal coverage to Medicare. It's not a credible coverage. It's not equal to Medicare. So folks who you've left your employer and you've continued with the COBRA, which is literally the exact same coverage you had when you worked. However, you are subject to a late enrollment penalty if you don't sign up for Medicare when you're eligible. So if you're 65 or older, you've retired, even if you decide that you're going to keep your COBRA for now, you still need to sign up for Medicare A and B, or you will be subjected to a late enrollment penalty. Also, you're not eligible for a special enrollment penalty when that ends. So when COBRA runs out, if you've missed your opportunity to sign up for Medicare A and especially B, you don't have the opportunity to go back and do that at that time. So you almost have to think of them as two entirely separate things. COBRA as somewhat separate than Medicare, even though they do work together. An example of coordination for benefits. So we're talking about Peggy here. Peggy's 66. She has Medicare A and B. She has retiree insurance from her former employer, but she's also covered by her husband's group health plan from his current employer that has more than 20 employees. So Peggy has a lot of insurance. How's that coordination going to work out? Her husband's current employer insurance is primary. It's going to pay first on any claim she has. Medicare is going to pay secondary. And if there is anything left over, her retiree insurance will pay third. As I said, Peggy is in really good shape insurance-wise. She has a lot of coverage. Most folks aren't in that situation, but Peggy is. All right, switching gears a little bit. Let's talk about federal employees. So federal employee health benefits, shortened once again to FEHB. So what is FEHB benefits? This covers current and former federal government employees. It's administered by the Office of Personnel Management, and I have their website up there, the omp.gov. As you've already been told tonight, when you're going to these sites, make sure it's a gov.gov, not a .com or a .org or something like that. If a beneficiary is retired and they are on federal employee health benefits and Medicare, Medicare is going to be primary, and the FEHB is going to pay secondary. So it's just like any other type of secondary insurance that's going to come in after Medicare. But FEHB will pay primary if the beneficiary does not enroll in Part B. A lot of folks who are federal employee, federal retirees do not enroll in Part B. They say, you know what, I'm not going to pay that monthly premium. I'm just going to put that off, and I'm going to just keep, maybe I'll sign up for Part A since I already paid for it, but I'm going to keep just my federal benefits. If that's the case, you can keep FEHB as the primary. But if you change your mind and decide you want to sign up for Part B later, you're not going to get a special enrollment period, and you're most likely going to get a late enrollment penalty. So if you're one of those folks who says, you know what, I'm a federal retiree, I'm not signing up for Part B, I'm not paying that premium for it, that's your decision. Just know on down the road, if you change your mind and decide that, no, I do want my Medicare Part B now, not only are you going to have to wait for an open enrollment time to sign up for that, you're also going to most likely, if it's late, be subject to a late enrollment penalty. There are plenty of beneficiaries who stay with FEHB and never enroll in Part B. Also keep in mind, if you disenroll from FEHB, so if you leave your federal benefits, they will not let you back in. You will not be able to get that back in the future. So if you are on that and you like that coverage, don't go off in the open market and see what's out there, because once you leave, you can't come back. Spend just a few minutes talking about military benefits. Tricare is, of course, coverage for folks who are active military. What we're going to talk about is the Tricare for Life. Tricare for Life. Now, this is Tricare coverage, again, for folks retired military, for individuals who are retired from the military and have Medicare. Retired from the military and have Medicare. So an individual, or it should say spouse, individual or spouse, who is eligible for premium-free Part A must sign up for A and B, and then the Tricare benefits are received through Tricare for Life. So basically how it's going to work out, Medicare is going to pay primary, Tricare for Life is going to pay secondary. If you look at the examples that some of the presenters before me were using, think of it almost as that option one. I have original Medicare A and B, Tricare for Life coming in as a supplement in a Part D drug claim. Tricare for Life, however, might even pay some stuff that Medicare typically does not. The most common example of that is care outside of the United States. Original Medicare A and B in most cases won't cover you outside of the U.S. Tricare often will. Tricare often will. Tricare for Life's drug coverage is also considered credible, meaning it meets all of Medicare's standards. That means if you're on the Tricare for Life and you use their prescription benefit and on down the road you decide that it's not enough, you want to go sign up for a Part D plan, you're not subject to any sort of penalty because you had creditable coverage that entire time. Staying with the military benefits, the Veterans Affairs benefits, the VA. VA benefits, this is coverage for individuals who are determined to have a disability related to active duty service. The VA can be a little bit tricky for us. VA benefits do not coordinate at all with Medicare benefits. There are two federal programs offering healthcare benefits, but they really don't work together real well. VA benefits covers some benefits not covered by Medicare, things like custodial, nursing home care. The VA drug coverage is considered credible. So an individual, again, can delay rolling in Part B without any sort of a late enrollment penalty, meaning if you are eligible, if you are a veteran, you are able to take advantage of the VA prescription benefit, you don't necessarily ever need to sign up for a Part D plan. If that changes, and you on down the road say, you know what, the VA, it's too much of a hassle for me getting over there to get my drugs. I'd like to be able to just go, to the drugstore on the corner. You can come back and sign up for a Part D plan, and you won't get any sort of a late enrollment penalty because your VA coverage was considered credible. However, individuals who are covered by VA benefits should enroll in Medicare when they're first eligible. They should enroll in the A and B. They're not going to get a special enrollment period if they do delay that enrollment. And again, you can be subject to penalties. Most of your Veterans Affairs folks would agree with us on that. I work with quite a few of them. They say, no, when you turn 65, when you're eligible for Medicare, go ahead and sign up, even if you plan on using the VA for everything. And then we're getting a little bit, we kind of touched on it way back in the beginning. Liability, no fault, and workers' compensation. So these are just some other cases where if someone else is going to pay for it, Medicare is not going to pay primary. So Medicare pays secondary to these types of insurances. Medicare sometimes will make a conditional payment as a primary payer, and the Benefits Coordinator and Recovery Center, the BCRC, will reimburse Medicare. So liability insurance, this is if someone else is responsible, think of the examples, if you're at a business and boy, you slip and you fall and you get injured, hey, that's not really something you want to come back on your Medicare for. That's, the place that didn't clean their floors. It's their responsibility. Liability insurance, no fault, same sort of thing. If you're in a state that has no fault rules, generally the insurance is going to be first involved. And then, of course, workers' compensation. Now, this is a state-administered program, pays healthcare claims related to job injuries. Sometimes can get a little tricky with Medicare, simply because workers' compensation is only going to pay for things directly related to that workplace injury. It can sometimes get a little tricky saying, well, no, this is the workplace injury, but this is something different. Overall, what we're saying here, though, is if someone else is responsible for paying, Medicare is going to pay secondary, or in some cases, they're not going to jump in there at all. Long-term care. Now, long-term care insurance is obviously insurance that covers long-term care. Long-term care could be called long-term services and support. And of course, we have the LTSS or custodial care. Now, what we mean by custodial care is it helps with the activities of daily living. So we're not talking about skilled care necessarily. Medicare covers skilled care as far as medical, physical therapy, speech therapy, occupational therapy, that sort of thing. We're more talking about someone who needs care on a regular basis, someone who needs someone to help them through their activities of daily living. How do they get up? How do they feed themselves? How do they, bathe, get dressed, all that stuff. Medicare alone does not cover the custodial care. Long-term care insurance covers care that Medicare does not. Many states also have long-term care partnership programs that includes inflation protection. It can protect your assets should you become eligible for Medicare. Some individuals may qualify for Medicaid coverage of long-term care, meaning how this most likely happens is a lot of times folks will go into a long-term care facility, and if they're self-pay, something like that, once they've spent a certain amount, once they've run out of money, so to speak, they're going to be eligible for Medicaid to keep them receiving that same care. And last, I think this is next to my last one here, is the health insurance marketplace. This is for the uninsured and the underinsured can purchase coverage through the marketplace. Medicare beneficiaries do not need to use the marketplace. This is more commonly known as what? Obamacare, right? It is called the health insurance marketplace. So Medicare products like the Medigap, the Advantage, the Part D, the stuff we've been learning about all afternoon are not sold through the marketplace. This is for folks who do not qualify for Medicare. Individuals enrolled in a marketplace plan with tax credits, they're going to lose those credits once they're enrolled in Medicare. And it is illegal to attempt to sell a marketplace plan to someone who is enrolled in Medicare. They're completely separate. Easiest way to think about it is Medicare is primary insurance. These health insurance marketplace plans are also primary insurance. You should not have two primary insurances. So once you're eligible for Medicare, this is no longer an issue for you. You are now talking about Medicare and whatever you want to add on to that, whether that be a supplement and a Part D with the option 1 or the Medicare Advantage with the option 2. An exception could be if an individual does not qualify for a premium-free Part A. We do see that once in a while. They can drop Medicare and enroll in a marketplace plan, but if they later decide, no, I do need Medicare, they could get a late enrollment penalty. They absolutely could get a late enrollment penalty for that. Bunch of the things that we've mentioned here, of course, Medicare.gov, SocialSecurity.gov, and we have the 800 numbers for all of those, and then the SHIPs as well, which we're going to see a little bit more fleshed out on my last slide here. So again, like everyone said this evening, if you do want an individual counseling assistance with your Medicare choices, you can contact your state health insurance assistance program, the SHIPs, or you can visit this website, shiphelp.org, and help you find your local SHIP. So with that, I think we're going to go to a Q&A session, and I will be on there as well, but I thank you folks for hanging in there with me.